It's interesting because you talk. I want to talk to you about your book a little bit because I had interviewed John Tamny, and we, have worked in the same settings with him, and he was very interesting about his thoughts on the Fed. And I know your latest book is about replacing tax code and reforming the Fed. And you stated that there were 3 big reforms we needed to address. Can you just explain what those are and how to fix them? Would help.
Yes. Health care. Mm-hmm. We do need a system that is more oriented to the patient. Mm-hmm. And I hope before the end of the year, the Republicans who are trying to live up to their moniker as the stupid party flounder on health care. I think eventually they'll do something, but they should recognize, just as the old cliche, Rome wasn't built in a day. You're not going to reform health care system in a day, but there are a lot of useful steps you can take to put more power in the hands of the patient. The problem with health care, Diane, is that it's all third party. Right. Insurers, government, Medicare, Medicaid, VA, it's big companies, and there's a disconnect between the patient and the doctor. And so hospitals know their revenues come not from pleasing you, the patient, but from how well they negotiate with third parties. Insurers want to get big so they can better negotiate with hospital chains. So the patient is on the bottom of this food chain, so to speak. Right. And the proof of it is the lousiest motel in America wouldn't dare put you in a room with another guest with a curtain in between, a sick guest, as they routinely do in a hospital. Right. So we recommend in the book a variety of ideas to start getting the patient back in charge. One is nationwide shopping for health insurance, so you get hundreds of companies competing for your business. Right now, if you live in Arizona, you can't buy a policy offered, say, in Colorado, which is ridiculous. You can buy an automobile in New Mexico, but you can't buy the insurance. Right. It's crazy. Invoke the Interstate Commerce Clause. Have a nationwide competition. Another thing, equal tax treatment. Unless you're self-employed or employer, you pay for insurance with after-tax dollars. So if you don't like what's being offered by your employer, or you're not offered a plan, you go out in the individual market, good luck, you're using after-tax dollars. That's crazy. Another one, transparency. Why shouldn't clinics and hospitals post prices for all their services? And you'll see some very strange things emerge. For example, a friend of mine in New Hampshire a couple of years ago, had some heart thing, and so he went to the cardiologist. One of the things the cardiologist recommended to him was you should take what they call a nuclear stress test, where they pump something in your body and they watch it flow through the bloodstream or whatever. But anyway, he then innocently asked the doc, "What does it cost?" The doc said, "I have no idea. Insurance will cover it." So you don't get the pricing system. So this guy, being an entrepreneur, went out, a great effort with his colleagues, got the prices of a nuclear stress test, which is routine. I mean, everyone does it the same way, so there's no difference in quality. And went to some 25 clinics and hospitals and got prices. Finally pried them out. And they ranged from $1,450 to $7,300.
Wow.
For same test. So have posting of prices so you can compare, especially now as we're getting more and more high deductible plans. We need to see those prices. Another thing, how about hospitals posting how many patients die of infections after they're admitted to the hospital?
I don't know if I'd want to see that, but
but you want to know a hospital that seems to have a problem. You want to say, I'll stay away from that one. Go to one that seems to know how to keep these things under control. So there are a lot of useful reforms. Another one, which hope the Republicans, despite their floundering, get to, is giving governors of states more discretion to reform Medicaid within their states. And I think you're going to see some very interesting things happen if they get that power, where you actually will save money and get better outcomes and make patients happier. For example, Rhode Island did a little bit of it a few years ago. One of the things they discovered is that instead of forcing patients to go into institutions, They did much better when they had home care. Well, home care was much cheaper than putting them in an institution, and the patient was happier.
Right.
So, win-win all around.
Yeah. Well,
Give some flexibility. I think you'll see some real positive reforms.